Hello, welcome back. I'm Akash Reddy, your host for today. We have an expert to share a doctor's perspective of hyperhidrosis. Welcome, Dr. Philippek. Can you please introduce yourself?
Yes, hi. Thanks for having me. I'm Catherine Philippek. I'm a physician assistant at Premier Dermatology in Atlanta or Alpharetta. I've been a physician assistant for about 20 years and have been helping people with hydrosis during that time.
Well, that's great. And to start off with, what are some key symptoms of hyperhidrosis and what causes them?
Good question. So some key symptoms is hyperhidrosis by definition is excessive sweating that's not caused by heat, exercise, or stress. And some key symptoms are excessive sweating. There's two primary types of hyperhidrosis. The first being primary hyperhidrosis or essential or focal hyperhidrosis is excessive sweating on your hands, your underarms, palms, feet. This usually happens on both sides of your body at the same time. Usually it starts occurring before 25 years of age and often can be a genetic type of a link. The second type of hyperhidrosis is called secondary hyperhidrosis, and this affects your whole body. This is usually due to a medical problem like diabetes or thyroid. Certain medications or infections can do this. Unfortunately, there's no cure. So we try to do the best we can with symptom management.
And you were mentioning there's no cure, but for those affected by hyperhidrosis, will it ever go away with age?
Generally, we don't see that it goes away. Different habits can make the symptoms a little bit better, but to this point, it's not something, unfortunately, that people tend to outgrow.
That's really interesting. And in your opinion, could there be any underlying diseases whose symptoms of excessive sweating align with hyperhidrosis?
Absolutely. So things like hyperthyroidism, sometimes nervous disorders, anxiety disorders, diabetes, obesity. And again, that would be the more generalized all over body sweating. If you just have the localized hands and feet, perhaps underarms and face, then usually it's not a disease process that's causing that.
Oh, wow, I never thought of that. And what treatment options are available for hyperhidrosis?
There's several, although somewhat limited. So the first and foremost thing that we recommend to people is just daily functioning changes. So wearing loose clothing. Something that people may not realize is excessive sweating can actually interact a bit with your body's normal flora or bacteria and can cause increased smell or odor. So showering frequently, washing like your feet, for example, can be very, very important. That's usually the first line. There are over-the-counter things that can be done. Aluminum-containing products like antiperspirants are a good start. And if those strike out, there's clinical strength antiperspirants, which are a little stronger. There's something called Carpe, which is available online or over-the-counter. That's about a 15% aluminum. Or I have been prescribing something called Davomatic or Drysol that is a 20%. And generally what you do with those is you put those on the affected area in the evening and continue to use your antiperspirant in the morning. And frequency can change depending on people's symptoms, if you have to put it on nightly or a couple times a week. If that doesn't work, then there are oral medications that generally we reserve for older teenagers or adults. The two medications primarily used are called glycopyrrolate or oxybutynin. Both of those do have systemic side effects as well. They kind of dry everything out. So although they help with sweating, they're also going to dry out your tears, your saliva, your urine. People react differently to those. So that's also not something we jump into, and that would be prescribed by your dermatologist. There's something called ionotophoresis, where you actually have pans of water and you can put your hands or your feet in those. They're low circulating current through that. And that is a treatment that you do multiple times throughout a week. Treatments generally will last between 10 and 20 minutes. And although the way that that works is not well understood, it does help some people to reduce the sweating in those areas as long as you're doing treatments. Botox is something that oftentimes people don't think about for hyperhidrosis, but this actually works similarly to the medications, but only in the localized area that they're injected. So although Botox works beautifully, it does get done with needles, and sometimes for kids and adolescents, it's not the most pleasant of experiences. It does tend to work very well and give people about 6 to 12 months relief, and it does have to keep being redone. Unfortunately, insurance does not cover that procedure, so it can be a little costly. There's a great laser that came out about 10 years ago called Miradraw that uses microwave technology, and primarily we use this in older adolescents, the younger children, and on the underarms. And generally in 1 to 2 treatments, you can see a significant improvement in the amount of sweating. And the way that that works is just the microwave energy basically ablates or destroys the sweat glands. Also, a little on the costlier side and not covered in the insurance. For the very, very severe cases and when everything else has failed, there are some surgical procedures, 2 of which, one, there is a surgeon can go in and actually remove the sweat glands. The other one is called endoscopic thoracic sympathomectomy. And what that is the surgeon actually inserts a small, or makes a small incision right underneath the armpit and inserts a tool to help actually detach the nerves. With any surgical procedure, there's some side effects, so that's usually a last resort.
And first, these surgical options, are they available for children who have excessive and severe cases of hyperhidrosis?
They are available. Generally, 9 to 10 would be about the earliest that some surgeons would consider working on these children. And again, it's a very last resort, but it is available.
That makes sense. And what is the impact of hyperhidrosis on one's mental health, their social anxiety, and their ability to enjoy everyday life and play sports like football, baseball, and basketball?
It can actually affect people more than others will realize. So little things like holding a tennis racket, throwing a baseball, being able to do teamwork and gymnastics can be difficult when your hands are very sweaty. So it can contribute to depression. It can contribute to low confidence, to anxiety. People can definitely feel ashamed. So from a mental health aspect, it can play a big role in that. But there are some things to do for people playing sports. The aluminum products generally will work well if they're applied prior to their activities. Even musicians or people doing things like debate, it can affect them as well. So considering the aluminum products, little things like carrying a towel with you to practice, using sweatbands on your wrists or your forehead can help. And sometimes even things like chalk can, you see baseball players and gymnastics, gymnasts using that frequently as well.
Yeah, and having hyperhidrosis myself, that is very relatable. And finally, do you have any recommendations to parents on how to help children to cope with hyperhidrosis?
Yes. So the earlier your child is, if you start to see symptoms or signs when they're sweating, even as early as 5, 6, 7 years old, don't hesitate to try some of the aluminum products. You can make a game changer for these kids at school. Sometimes there's some teasing or anxiety that the kids are experiencing that you may not know about. So open line of communication with your kids. Don't shame them. Don't make them feel bad. They have absolutely no control over it. Encourage them to have better hygiene. If they need to start showering a little more frequently, washing their feet with antibacterial soap can actually help, or even their body with antibacterial soap. That will help to decrease the bacteria that the sweat can interact with for the potential odor. And then even just being communicative. As far as kids, it goes back to them as well. It's important to keep an open line of communication with your parents. Let your pediatrician know at your well visit if you start to notice any changes. And a lot of people don't realize that there's actually sometimes some interaction with some foods that you consume, things like caffeine, some spicy foods, sometimes even things like peanut butter. So if you notice certain correlations with things that you're ingesting, you can try to avoid those.
Thank you so much, Dr. Philipek. I'm grateful that you accepted our invitation today, and I'm sure our audience will benefit from your insight.
Well, thank you very much for having me.
Thank you for joining us today. In the next episode, we will learn more about hyperhidrosis from the perspective of a parent. As for now, more information about hyperhidrosis for children, as well as useful resources, current research, and fundraisers for clinical and laboratory-based research can all be found in the description below. Thank you.